Hello, this is Dr. Eldred Taylor, and we're here with one of our speakers for our annual American Functional Medicine Association conference at the Georgia World Congress Center in Atlanta, Georgia on November 10th through the 12th, 2016. And the speaker we'll be interviewing today is Dr. Denise Worden. Dr. Worden is an Arizona-based physician and global health educator. She is renowned for identifying and helping to bring unique healing modalities and therapies from abroad to the United States. Dr. Worden is a highly regarded expert in enzyme therapy, regenerative injection therapies, and bioenergetic medicine. As a sought-after CME speaker, Dr. Worden has lectured for the American Academy of Pain Management, the American Association of Naturopathic Physicians, and various medical schools, including the University of Arizona, Arizona State University, Berkeley, and major U.S. hospitals. She appears frequently in TV and radio shows and news spots as a popular guest. Dr. Worden will be speaking. She'll actually be giving two lectures. She was a very popular speaker last year, so we wanted her to come back and hear as much information from her as possible. So this year she will be speaking about the combination homeopathic injectables for pain, inflammation, and immune support. And her second lecture will be clinical use of cold lasers and frequency medicine in primary care and aesthetics. Dr. Worden, how are you doing?
I am doing fine, thank you.
Well, great. Well,
And
great.
I appreciate the opportunity to come to AFMA again. I will tell you that last year when I lectured, I was so impressed with the quality of your speakers, of your organization, and of even the attendees of the physicians. What a great group. I mean, I do a lot of lecturing across the country to multiple groups, and you've got the heart, you've got the science, you've got both sides. I just want to put that out there.
Well, great. Well, we'll send you a check later for that commercial.
Okay.
Thank you so much for that impromptu endorsement. We appreciate that. But now let's talk about you. What can our attendees expect to hear from you this year?
Well, two lectures, and the first one I'll talk about here, it is combination homeopathic injections. And, you know, we're always looking, especially in pain management, immunology, in these conditions that we tend to struggle with in traditional type of therapies. And I've been working for about 17 years with these combination injections, homeopathics, with absolutely wonderful success. And so I'm excited this year. There are some new injectables. It's not a new company. It's a very entrenched German company that's been around for over 60 years, a leading manufacturer. But they are getting their new injectables into the United States. So I'm excited to talk about some of the new things there. But for the CME purposes, looking at how do we utilize these homeopathic injections, both IM, intra-articular, IV, sub-Q, looking at the basics of how they're used and understanding that homeopathics are regulated as pharmaceuticals. They're not regulated as nutritional products in the food industry. These literally have to go through rigorous trials efficacy trials and safety trials before they get in the United States. And we're seeing more and more studies being done in the States, not just in Europe, but in the States on homeopathy and especially these injectables. So I'm very excited to talk to the attendees about the ingredients that they can be looking for in some of these injectables, how they may think about utilizing them for inflammation and pain and immune support, specific conditions, and how they can utilize those in their practice and not have to worry about side effects, not have to worry about contraindications or having issues with, using pharmaceuticals at the same time. That we're allowed to be able to combine these with conventional treatments with no known drug interaction. It's an area that's growing and an area that any of us that do injections or work with any of these areas are excited to always learn more about.
Now, let me ask this. What is the difference between that and prolotherapy? I don't do a lot of injections for pain.
Right.
I know that's one. So how is that different?
Right. So prolotherapy is usually using a topical anesthetic, so that's not a homeopathic, right? And it's using dextrose. And the purpose of prolotherapy, for the most part, is injecting a sclerosing agent or an agent that causes inflammation. It's trying to get the body to regenerate or lay down a new tissue, so to speak, in response to inflammation. Its best indication is for loose ligaments, to be able to get there right at the attachment and cause an inflammatory response where the body can lock down that ligament and make a more functional and, a functional would be the best way to say joint. That's its best indication. Homeopathy is not causing inflammation. It's really anti-inflammatory, and it's helping the body modulate the immune system. So it's not a pharmaceutical in the sense of what we think about our other injectables. Even though it's regulated as one, these are very low dose, very safe ingredients that have been used for a very long time in Europe and in the States for really going about things differently, trying to ask the immune system or the body to modulate. Let's take osteoarthritis, for example. When you inject these types of homeopathics, we're working on the osteoclast and the osteoblast, asking the body's own system to do a better job of cleaning and repairing and laying down new tissue. So it's going about it a different way. In homeopathy, I will go into the explanation in the lecture of really what is homeopathy, how do we look at it, how do we believe the mechanism of action is working, and how it is very different than any other substance, be it a nutraceutical or a pharmaceutical.
Yeah. I always give the example, Queen Elizabeth, I think, has her own private homeopathic physician.
That's
I think
right.
I'm correct. And she's 90 and she looks she looks great. So if
Yep,
you can be the poster child for what homeopathy can do for a person. So well,
that's right.
Yeah, well, that's great. That's very interesting because inflammation is like the top priority in medicine now. So any way to
That's
treat
right.
inflammation is always going to be a
That's right.
plus. And so I guess it's
That's right.
effective for autoimmune diseases too, if it helps to regulate the immune system. Is that correct?
Yes, it does. And especially, I will say, most of the studies have been done in pain and in nerve regeneration. So, specific, sciatic, trigeminal, post-herpetic, looking at that, being trialed. One of the injectables I'll talk about is for lymphatic edema. And then also on the behavioral health side, for sleep disorders, for insomnia, depression, mental exhaustion. So it's being used in the gamut in medicine. And detoxification is a very big area. And the liver and biliary systems, the hepatic and biliary, those are all will be addressed in this lecture, and how we've got specific ingredients that we can go after to help beyond pain and beyond the inflammation, even though you and I both know inflammation is the root of most things,
Right.
but the immune support as well.
Well, great. Well, that's very exciting. I'm anxious to hear about that because I'm sure with homeopathy it's not very expensive too, especially as high as pharmaceutical drugs are. That it's a reasonable price that most people can afford.
That's right. It's very inexpensive to the physician and inexpensive in the sense to the patient, but the physician obviously by their skill set is going to charge for their time.
Yeah.
So if I look at the return on investment as a physician, I say this costs me less. I don't have to worry about the side effects. I've got good efficacy, and I can still charge the same amount for my time in giving these injections.
Exactly. Okay, well that's very exciting. I look forward to that. Now, your second lecture is clinical use of cold lasers and frequency medicine in primary care and aesthetics. So tell us a little bit about that.
Right. So that is one of my favorite lectures and topics to talk about. You have another lecture this year as well, Dr. James Oshman, who wrote the book Energy Medicine Scientific Basis. So your attendees are going to get a very good understanding of the actual science behind all these devices they hear about or they may try to utilize. They may have some, we call it, laser graveyards sitting in their clinics, and maybe it was the way they were using them or how. So I think by the end of the conference this year, very good understanding of the science that we do have and what the biostimulating effects on tissues are, all the leading edge research that's coming out, and it is daily. I know I've already, we have to turn in our CME lectures ahead of time, but I guarantee by the time I give the lecture, there will be more studies that will have been done. Very big area, in medicine and in research. Again, started out in pain management and nerve regeneration as well, but being utilized for multiple reasons, and also not just in primary care, but aesthetic medicine is really taking hold. And as you know, we all know that anyone in the medical world today is looking for adjuncts, for things that they can do within their practice that they can make a little bit more income just because of the way the structure is right now. And aesthetic medicine is big. And some people may say, I don't want to step into the Botox world. I don't want to step into the filler world. I don't want to be just another one of those shot clinics. And it's okay if they do, but if they say, I want to do something aesthetically that doesn't, that is a lot more safe, that's efficacious than these lasers and some of these devices that I'll be talking about in here, is something that they should be looking at. And the cold lasers in specific, for 20 years, I've been lecturing on laser physics and teaching physicians, and I just think they're not utilized enough in practice. It jumpstarts the body into such a quick healing process or a regeneration process that I'm very excited to talk about low-level lasers and other devices that are out there we can utilize in our practices.
Well, great. Well, that you're right with this present climate in medicine.
Right.
All physicians are looking for something, and I always say it needs to be something that's good for the patient. It needs to be something that's makes the doctor feel like he's doing something for the patient, and then it
That's
also
right.
needs to be good for the business of your practice. Also, you can't help anybody if you can't keep your doors open.
Right.
So
That's exactly right.
yeah, so that's
That's
very
exactly
important.
right.
So,
So,
well,
as
mhm,
physicians, the things we can market best are the things that we really believe in. And
exactly.
so when you see the efficacy and you know that you're not causing harm, that you're getting great results in our clinical practice with these, and it's easier to go out there and talk about it and market it and
Right.
have the science behind it. So,
Exactly.
yeah.
Okay. Well, Dr. Worden, it's always a pleasure to talk with you. You're always a high energy person. You can get me excited about whatever you talk about. So it's always a pleasure to speak with you, and we look forward to hearing you in November. And we're excited about what you're going to present. I think it's something that our physicians will be able to evaluate and hopefully bring into their practice and help more of their patients. So that's what we try to do at the American Functional Medicine Association, is give our attendees something that they can go home with and use
That's right.
and use to
Right.
help enhance their practice. So, well, I thank
That's
you so
right.
much for
Good.
taking time out to give us a little preview of your lecture. And again, we look forward to seeing you in November.
I look forward to it too. We'll see you soon.
Okay,
Thank
great.
you.
All right. Good
Uh-huh.
afternoon.